Dr. Mothi S N is a senior consultant pediatrician who has been serving the children of Mysuru with dedication since 1981. He completed his MBBS from JJM Medical College, Davangere, his DCH from Mysore Medical College, and his MD from Bangalore Medical College. He is the founder, trustee, and chairman of Asha Kirana Charitable Trust and Research Hospital, Mysuru, a not for profit institution that has been providing continuous care and hope to people living with HIV/AIDS since 1997. True to its name, Asha Kirana remains a ray of hope for thousands of families. Dr. Mothi has contributed at the national level as a member of the Technical Resource Group on Pediatric AIDS under NACO and has played a key role in organizing major international and national conferences, including the India International Pediatric AIDS Conference held in Mysuru. He is also the founder chairman of the Mysuru Adolescent Health Academy and served as the president of the Indian Academy of Pediatrics, Karnataka in 2024. His extraordinary service has been recognized with several honors, including the Rotary Paul Harris Fellowship, the Manava Ratna Award, and honorary Rotarian membership of Rotary Club of Ivory City. Sneha Saurabha warmly welcomes Dr. Mothi S N.
A very good morning, all of you. Paying my respects to District Governor 3181, Rotarian Ramakrishna, and the entire district team and members of a number of Rotary clubs of this district, Inner Wheel Club members, invitees and guests, ladies and gentlemen. At the very outset, I'd like to place on record the wonderful way the tone was set for this morning with a wonderful rendition of music by Smita and team. And I take this as a very privileged opportunity to be amidst you, because as a pediatrician, I have a lot of regard and respect for Rotary movement. A small initiative which you took it up as Polio Free India, how it became a movement and made such remarkable difference over the years, for which I must say the entire pediatric fraternity is always remaining indebted to you. On that note, I would like to make a presentation as a pediatrician to begin with, and how I took up the issues and challenges centering around HIV/AIDS. My 30 years of journey, I'll just try to compile it in about 25 to 30 minutes, understanding that there are more presentations which I am also very eager to listen to. And it's such a joy to have quite a few familiar faces, and I must thank Dr. Prahlad for having given me this privileged opportunity to be amidst you. Okay? And I'll walk you through the wards and corridors of our standalone hospital, which is treating people with HIV/AIDS, the only standalone hospital in the entire South India, which is doing its work since last 27 years. So you can just get to understand what's happening. This is my journey and my quest. And I began my pediatric practice in 1981. And initial 15 to 16 years I consider as a formative years, where I was able to establish a rapport and credibility with the citizenry of Mysore, who could understand my level of involvement and commitment and passion. That is how it all began. And these are the patients waiting in our clinic. And many a times our work gets further energized, because some of the children who win their awards and medals will come and share their moments of joyful experiences, which will also get us charged that we don't need to get really tired. And I shouldn't be complaining, because my father, who is all of 97 years, is still a practicing homeopath. I shouldn't be really complaining that I'm hardworking. It all started in 97 when Dr. Sunita Solomon, who first documented an HIV case in India, until then no one believed HIV will not make an entry into India because we are culturally very rich. But when it was documented and the journey began, 97 we had invited her to Lions Club program. She did a program for schools and colleges, Lions Club, and also did a program for doctors. That's when everyone said, no one is doing anything about HIV/AIDS, Dr. Mothi, why don't you really start doing something? That's how our journey began. And coming together of 7 friends, we have about 4 Lion members, we have Ryan Irani, a Rotarian, all of them, we constituted a trust. And what happened next was, we started a first ever free awareness and counseling center and also a walk-in clinic for people with HIV/AIDS. Until then, even the government had not implemented any intervention programs. And we were given a small place in Jain Hospital, very close to my clinic, in Mahavir Hospital, where artificial Rotary Limb Center is also located. They had given us 1-room facility. Before I went to the clinic, I started going there about 2 hours, started looking up patients who were coming with lot of apprehension, anxiety, fear. No medicine was available then. But we were only had to be doing some counseling, giving some cetera prophylaxis. And that's how it started. And TB Hospital Sanatorium, they gave us a small place where TB positive, HIV positive people were there. Our counselors went and they started providing services. And when we did that, we realized there was a lot of need to create a kind of public awareness and awakening. And we did an all religions conclave where we had a Maulvi from the mosque and Bishop of Mysore and Swami Muktidanandaji, all of them gave message that they should not be discriminated, they should not be stigmatized, they should be accepted in the mainstream life. This was the message that we had to really give. And we, initial 6 to 7 years were very formative years, I consider. We did lot of schools and colleges and village outreach programs. We covered close to about 60 villages in Mysore Taluk doing programs amidst, we were there doing in the backyard of a house, in front of a temple, wherever possible, our team went and did awareness programs. And we did a lot of schools and colleges program. Here I'd like to make a mention. Rotarian Mahesh was so largely encouraging and instrumental when we did initially. I think my wife Nalini used to do lots of schools and colleges program. He used to facilitate all these. And we were able to present a paper of this in Malaysia conference where it got huge acclaimed, and he said it was so necessary that we had to look into these. And we also did a lot of World AIDS Day program. We used to distribute these banners, and after their prayer time, assembly time, they used to carry these and walk in the neighborhood so that we could create more and more awareness about HIV/AIDS. And road tractors worked with us and we trained them. They wore these apron, 1 man, 1 woman, no AIDS. And along with railways, they traveled in the train, Mysore to Bangalore, Chamarajnagar. They distributed pamphlets, interacted with people, creating awareness. This was very essential because people scarcely believed HIV/AIDS were ever recorded in India, in our part of the. We also trained a lot of students to do street plays in the near the railway station, bus stand, wherever people were congregating. And we did a lot of poster painting contest and all these students brought out beautiful canvas which we used as educational material. We thought we should go with the changing trend. Instead of write elocution contest or essay contest, why not we do a group dance competition, fashion show competition. And believe me, students came out with some brilliantly choreographed messages about HIV/AIDS. We did this and it was a sellout success amongst the youngsters. And we signed an MOU with Confederation of Industries and we covered about 60 industrial campuses. In the afternoon, whenever there was a change of shift, we used to go in the afternoon and do awareness because a lot of anxiety was there and a campus culture was prevalent even in the industry. And we presented this paper in South Africa to create an awakening that industrial campuses also need to be covered whenever we talk about awareness. And we had to give these kind of messages, how it spreads and how it does not spread. How it does not spread had to be very emphatically conveyed because people had a lot of apprehension to get someone in their neighborhood having HIV positive status. And we had to give them messages like this, ABCD of safe sex. And we had to give messages which would catch their imagination. do no evil, see no evil, and also if you are indulging in any evil, also use a condom. These were the kind of messages we had to give. And what is very concerning, I was just sharing with Rotary Mahesh now, the present day trend, rave parties and drugs and consensual, unprotected sex are becoming fashionable amongst educated and elite class of people. Just about a month ago, I received a call past midnight from a senior pediatrician in Mysore. He called up and told me, my son is an IT guy. They had their late night party. After that, he came back home 5 in the morning. I don't know what was his indulgence. He is worried, he is anxious, he is depressed. When we sent words to him and did counseling, we understood how long and how deep he had progressed. When we asked him, was it not necessary that he could have taken precaution, he said instantly, she didn't look like that. That is the kind of concerns we get to see present day, because it's like not wearing a helmet is an act of courage amongst our youngsters. They don't consider it's an act of responsibility. These are some of the messages we need to really get across to them. And these are kind of messages given by National AIDS Control Organization also. And what were the challenges we found initially? A cook in a hotel was positive. An employee in an industry was positive. No one is willing to touch the files he brings in. A young couple in a village is testing positive. Neighbors are threatening them. Leave the village. You're not supposed to be here. And even the police also summoned them. It is being told that you're HIV positive. Leave. Then we had to do a program for the police department and police training college that they had to safeguard the interest and rights of people who are HIV positive. They should not be denied this kind of an irresponsible, indiscreet. And the outreach team used to alleviate their anxiety, and we used to create a lot of messages like this. And we also worked in the prison of Mysore, 98 to 2003. State government sent a recommendation, get all the prison inmates tested for HIV. But there was no money. Each test was costing 200, 300 rupees for about 1,000 population, in estimated cost of several lakhs of rupees. No one was willing to do. I made a presentation in Rotary Mysore under Rotarian PDG, our guru, and I made a presentation. They sanctioned the money to buy the testing kits, and we mobilized the students of social work department in university, and we did the counseling of all the inmates, and we tested, and we found 3% positive. I presented this data in Durban conference. Then one of the senior inmates asked me, Dr. Mothi, you say sharp blades ಇಂದಲೂ HIV spread ಆಗ್ಬೋದು ಅಂತ ಹೇಳ್ತೀರಾ. ಇಲ್ಲಿ ಒಂದೇ ಬ್ಲೇಡಲ್ಲಿ 16 ಜನಕ್ಕೆ ಮಾಡ್ತಾರೆ. Until the last one is painfully bleeding. Does it not spread? We knew that, and then I spoke to Wilkinson's Ford India ಅಂತ ಒಂದು ಕಂಪನಿ ಇತ್ತು ಇಲ್ಲಿ, ಮೈಸೂರು ಬ್ಲೇಡ್ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರಿಂಗ್ ಕಂಪನಿ. When I spoke to them, they launched the first safe blade initiative in the state of Karnataka. They provided us the blade, and we made a remarkable beginning and had sent a recommendation to the state government. Afterwards, it became an order of the day. And we presented this data in the Durban conference, how it was important that we need to look into this, because there was 3% positivity in prisons of Mysore. And I must tell you, Rotarian past district governor Guru heard me in Mangalore conference, in one of the district conferences in Udupi. Then he was the one who mobilized resources to test our prison inmates, and he also conferred an honorary Polaris Fellow, which gives me such a sense of belonging with all of you to be here today. And we did a lot of awareness program, basic for paramedics. We used to talk to them about basics of HIV/AIDS, how they need to take precautions, because now after COVID, we know how precautions need to be taken. At that point of time, there was no dental surgeons were never using gloves. They said, we are happy working barehanded. This was the kind of scenario, and we used to train them to provide unstigmatized care. It's not just that we used to do CME for doctors. We traveled close to about 13 districts of Karnataka, creating awareness and creating a kind of awakening among doctors to make a policy to treat people with HIV/AIDS, because no government program was there in those years. In the initial 6 to 7 years, we tried very hard doing this. 2001, at that point of time, there was no HIV medicine free rollout, was not available. It came in 2008. A particular month, we lost about 3 children, which was very difficult for me to take as a pediatrician. I told my trustees, I really want to stop working. There's no point any further. At least let us save children. Then we mobilized resources, trustees contributed, well-meaning citizenry sponsored children, and we adopted about 25 children, providing free treatment. After 2008, they were put into national program. So what we were able to accomplish before, and we started the first ever rollout in 2002, and before treatment and after treatment, how they were resigned to superstition and fate became so positive. Many a times, many of those who made contributions, they were asking, Dr. Mothi, why you want to treat them? 16 ವರ್ಷದಲ್ಲಿ ಅವ್ರು ಸತ್ತು ಹೋಗ್ಬಿಡ್ತಾರಲ್ವಾ, ಯಾಕೆ ಅವರಿಗೆ, why should you really be treating? It was always bugging me until a particular day, a few months after we started this rollout, a mother recovering from her stroke because of HIV, she came and she said, my 6-year-old son who is on medication is eating well, going to school, God bless you, Dr. Mothi. And she said, while she was walking out with a walking stick in one hand and her son holding her the other hand, I thought I never made a mistake having in this direction. And in 2003, we felt there was a need to have a standalone hospital, because at that point of time, standalone hospital was considered a place for stigma. But later, we had to go through a lot of challenges to make it acceptable in the society, because a lot of people who are in hospital setting, when they are HIV positive, they get discriminated, they get exploited, but that doesn't happen when they walk into our facility. We built the first phase of the hospital. What was a very gratifying moment for me was I was able to dedicate this to my mentor, Dr. Benakappa, who mentored my pediatric skills those years. And we have our own counseling and OPD care, inpatient care facility. We have about 30 bed facility, and lot of corporates gave us X-ray machines and emergency care equipments and in-house diagnostic services, because we are located in the outskirts of Mysore. Getting tests done in the city again will cost a lot of money to travel, and a lot of contributions are provided, and we built the second phase and third phase of the hospital because our patient inflow was increasing and we had to enhance our requirement. And it stands today as the only standalone hospital in the entire South. We have covered more than 12,000 people with HIV/AIDS and our 500 children who have grown into adolescent and youth presently. And our HIV-free medication in 2010 was provided by National AIDS Control Organization, which we have been having in our place. Women are a mistaken group in AIDS epidemic. Women in AIDS epidemic are not just sex workers. They are wives, daughters, mothers, and even care providers. But it's always a judgmental way we think. A woman is positive. Is she indiscreet? Is she promiscuous? That's how we think. But we don't seem to. And HIV/AIDS has reduced a number of our daughters into young widows who have nowhere to go, no one to care, only fingers pointing from all around. Many a times, youngsters who go for pregnancy testing, antenatal testing, the first time they test positive, HIV positive, they come back crying, I didn't do anything. And the background is probably her husband, who was a migrant worker or a trucker, was indulgent. He brought the infection and gave it to her. And she comes back crying. A woman can be a mother or a daughter, and many a time she is the only care provider who takes care of people who have got infected and admitted in the hospital. From a wife's point of view, there is no safe sex because they consider there are no safe husbands. Sorry to offend anybody, right? And the day I was told I had AIDS, I started living. And the day I became pregnant, I started dreaming. In those years, 20 years ago, when a woman was tested HIV positive and conceived, even OB/GYN were telling, why you want to continue pregnancy? Because your child is a vulnerable child, can have infection, and you are going to have a very shortened lifespan, and your child is going to become an orphan. This was the kind of situation in the initial years. We had to do a lot of programs to get doctors also inspired and involved into providing care. At that point of time, we instituted a extended protocol treatment because NACO was giving only one single drug medicine. We expanded protocol to save these more number of children across the state. we did in so many districts, we implemented this program so that we could give more medicine during pregnancy so that a child can be more effectively saved from getting infection. And we were able to cover close to about 87,000 pregnant women out of 462 who were positive. Because of our extended protocol which was given, less than 5% became infected. Otherwise, it would have been 50% risk of transmission. And we also created opportunities for vocational rehabilitation so that they could live with self-respect and dignity. And Innovil clubs have been constantly partnering in care. Many people of our HIV/AIDS who require some surgery, some additional care referred to other hospitals, they always make contributions, and Dr. Swami is constantly in touch with them. They make contributions to our poor patient fund so that we can continue to, in every stage of this thing, I think Rotary's hand-holding has been phenomenal and very encouraging, and we feel so humbled and inspired. Sometimes even family members are unconcerned and indifferent towards their patients in the hospital. In Asha Kirana, we strive hard and to save lives. And every second Sunday used to be pediatric clinic day until COVID times, because a lot of our children have grown up into adolescent years, and we used to make it interesting for them, having some group meetings, competitions for them, and festival celebrations. And all over there used to be summer camps for so many children. Why not our children also have an opportunity? We conducted a monsoon magic camp so that they could also feel free to cut open and express their concerns and feeling well-being. We also conducted a camp rainbow in DePaul school so that they could have 3 or 4 days of in-house experience of doing a summer camp. And I visited, Dr. Suniti was the one who inspired our work. Her work was going on in Chennai. I visited about 20 odd years, right from 98 to 2020. I used to go on Saturday evening to Chennai, and Sunday morning to evening I used to see their pediatric cases. This I did for 22 years because I had to streamline their pediatric care program. And 2009, we did the first ever India International Pediatric HIV Conference, and we also realized there is a need. Patients who come to Asha Kirana alone should not get quality care, even other doctors. And we do every year annual pediatric update conference for all medical officers throughout the state. We invite them, and the entire conference expenses is nil to the participants. We provide them full scholarship, we provide them travel grant, we provide them accommodation, and we have faculty, national and international faculty, who give additional learning so that they can provide good quality care for people who get treated in their institutions. And I'll just quickly run through a few unheard voices which continue to echo in our wards and corridors. Before the treatment was available, there was this Jyoti who was a beautiful adolescent. She was lured by friends, taken to Bangalore, and ended up in Kamatipura, Mumbai, as a sex worker. 8 to 10 months of darkness, so many clients per day, fights, punishment. There was not just another client. A tailor helped her miraculously escape from there. When she escaped and came back, she was 5 months pregnant. Your mother was not willing to accept. Father stood by her. She underwent a termination of pregnancy, and she developed sepsis, and she was discriminated, discarded from hospitals and nursing homes. And when she came to Asha Kirana, she said, look what they have done. She ripped open her blouse. She was a bag of skin and bones. I really choked. And look what they have done to my hair, my skin. Asha Kirana provided shelter and food. She was just hungry. And after that point of time, there was no medicine available. She went back home, and her problems continued. Several months later, her father appeared in my clinic, pediatric clinic. She said, Jyoti is not doing too well, Dr. Mothi. She is very sick. Then I gave some medicines, symptomatic medicines that he could take. He was not willing to bring her because she was very drained out. And I gave a pen which was there on the table. I told her, give this to Jyoti. A month later, I received a message. Dr. Mothi, she died in her sleep. She carried your pen until her dying moments. What I felt was an inanimate object like a pen could give so much of comfort. But how is it that we tend to remain so judgmental about people who have got HIV/AIDS? But many such voices were silenced and buried. Rajappa was blinded due to AIDS, lost hearing due to medications and infections, and he always screamed with pain, wanting to be heard. And he recognized our doctors and nurses by mere touch. Dr. Swami, this is you. Venkama sister, this is you. By mere touch he was able to. And several months after his silence, we still hear echoes. Because Rajappa's voice was so loud and echoing all corners. These are the lives which have really inspired. And early in the epidemic, many such lives were buried. Their voice continues to echo, reminding us we still have an obligation to fulfill. A look of compassion, a word of kindness, a tender touch, or a moment just in silence is very rare to come by. I took this picture in Melbourne conference. There was a photo exhibition. The story here is the lady who's advanced HIV disease. The only person she has with her to give comfort is the dog. Look at the expression that transmits between the two. Does it indicate it is the human compassion failure? I think we need to give a thought. And there was 16-year-old Jaya, who was HIV positive. She was sexually abused by her uncle several times. She presents with fear, anxiety, and fear psychosis. She never lets anybody coming close to her. She screams, "Don't touch me, go away." She developed cryptococcal meningitis, Dr. Nisarga. She went into coma, and after her treatment a week later, she gradually opened eyes, and for the first time, she smiled, and she looked eye to eye to her doctors and nurses. And few days prior to discharge, she said, "I want to buy flowers for our Friday prayers." Now, what is very gratifying is, she is on HIV medicine treatment. She is working as a counselor in an NGO, and she is a mother of HIV negative child. This is just a 2-slide story, but it has required 12 to 15 years of hand-holding and walking along them. That is actually what is a very challenging time for all of us. Rising from ashes of fear and despair to make a new beginning with rekindled hope. It requires tremendous amount of resilience and courage. Sunil was an 8-year-old. His granny was just about 35 kgs. When he became orphaned, losing both his parents, his uncles wanted to sell him for bonded labor. She ran away with him, lived different places, got him educated, taught him to make some agarbatti and all that. And after few years passing by, he went into depression. He was treated. Then, unfortunately, Granny developed an upper GI malignancy. She developed a stomach cancer, and she became an inoperable stage. We provided last palliative care in the hospital, and she said, "Guru sir, Dr. Swami, Dr. Mothi, don't let my grandson become an orphan." Now I must say, we have adopted him in Asha Kirna. He is a gardener, he is an office assistant, and he loves his plants and birds. We have never let go of the granny's dream of allowing him being exploited. In all these times, we had, there's another story of Sagar, a 10-year-old who was selling tea in a marketplace, and he was earning some money for sister's education. Years passing by, mother became very sick, and she never recovered. But Sagar continued to work so that he could support his sister's education and marriage. And after she got married in 2022, he got married, and he started another challenging journey. He is married to another HIV positive girl, and they have 2 HIV negative children. This only gives us the satisfaction. Life came full circle. I think what we began, there was no hope. What was a rapidly progressive fatal illness now has become a chronic manageable illness. These are the 25 children amongst whom so many of them are employed, very lively, and want to really work towards a betterment of life. And I must tell you about a few months ago, I had a phone call from a doctor in Lucknow Medical College. He asked me, he identified his name. "Yeah, I used to see you in Chennai pediatric clinic." Then he said, "I'm doing MD pediatrics in this medical college. Dr. Mothi, do you still use your fountain pen to write prescriptions?" Then I said, "I do that." Then he said, "I continue to do the same thing as a token of respect." I think these are some of the moments which will really get us inspired and motivated. We should not be complaining we are tired. And we also did matchmaking for young adults because they can't put matrimonial advertisements being HIV positive. So Dr. Swami conceptualized, we had representatives from all the districts of Karnataka, I think a lot of youngsters came, and about 5 to 6 matrimonial matches were able to be complete so that they could have a place to live with greater self-respect and dignity. And these are our HIV negative children who are born to positive parents, and Dr. Swami is having his birthday being celebrated with all these children clinging on to them. And in 2020, we launched the first LGBT transgender clinic in Asha Kirana. And I always consider, when we see a transgender, we have a mindset that we look down upon them. ತುಚ್ಛವಾಗಿ ಕಾಣ್ತೀವಿ, ಹಾಸ್ಯಾಸ್ಪದವಾಗಿ ನೋಡ್ತೀವಿ. But why don't we realize terminologies like love, friendship, affection, care, concern, and compassion, all these are gender neutral. But why we become very concerned about LGBT? And to add to our work, one of the corporates started a Spandana drop-in center at the heart of the city where they get to meet and share their concerns. And this is something which we have been doing regularly because they didn't know when they go to the hospital, they don't know whether they have to go to the male side queue, female side queue. And all of them who come to Asha Kirana receive free treatment and free counseling services. And 2019, we started Putta Hejje anta, we started an early intervention program for children who have got developmental delay. Shashikala Ramnath, quite a few of you will have been familiar, who retired from as a professor in JSS Medical College. She is volunteering her time and has a team, developmental delay iros, angavikalate iro makkalige, they do rehab program, occupation therapy, and physiotherapy services are provided, and they do remarkable work. I think a lot of times we have they have covered close to about 800 families so far. And very recently, we have one of the Innovil Club members who came and donated play equipments for these children so that it could be more purposeful and useful. Okay? And in COVID times, we upgraded our hospital as a COVID care center, and we had our own institution treatment protocol. Our people also worked relentlessly, and Gurraj was HIV positive. He was admitted in the hospital, sitting there, he was overseeing what all needs to be done and how we could really go forward. And we also started the COVID vaccination drive with the Deputy Commissioner, that point of time, Rohini Sinduri was there. We had about 25 hospitals across the city of Mysore who participated in this. And we also took this vaccination to industrial campuses, into apartment complexes so that we could do. And it's not just that. Dr. Swami, every Thursday in Raghavendra Swami Mata, evening Jayalakshmi Puramalli, Sayankala, he is there in the place doing free health checkup for people who come there. Now what I mean to say is, to be charitable, it is not dependent on money or resources. It is a mindset. After I underwent an angioplasty 7 years ago, I started doing free clinic twice a month in Kabir Road, where there is a Krishna temple is there. I do, after my clinic is over at 8:30, I go there, look up some children around. Because my father wished, he made a beginning there, he wants to pay back to that particular area. And recently we have started a ambulance life support clinic, adopting several villages in Narsipura Taluk, and every day our medical officers go there. And I am also involved in police helpline, which provides counseling services. Lot of Rotarian members also are there as members, and I pay my respect to our trustee whom we lost during COVID times, who was largely instrumental in mobilizing resources. Our hospital, when you walk through, you will have so many donors and contributors whose names are there as the plates. So I always say, Asha Kirana is a testimony of collective commitment of the citizenry of Mysore, who believed in my work, who believed in my dream, which continued to energize all these years. Is it over? I thought there may be another 2 or 3. Do I have another 3 minutes? Another 3 minutes. Okay. And my acknowledgements, the trustees and families who believed in our work, the patrons and donors, and consultants, networking consultants who helped our work. And I still very fondly remember lot of counseling I learned with Anupama also being there, and we know how Ravindranath also was helping us doing a lot of this work. And I must tell you, Guru Raj, I go twice a week to the hospital. He is there 5 days a week doing a lot of looking into the administration. And what was a one-man's journey, now we have a close to 35 people who are in our team. And I must pay my acknowledgements to Rotary clubs who have recognized and believed and motivated my work all these years. And I feel greatly indebted to all this. And I must tell you, the old and the beautiful, the rich and the famous, the holy and the priest all end up in the same dust. But why there are fingers pointing? In this journey, we crossed phases of ups and downs, issues and challenges, sweat and tears, tales of suffering, sacrifices, courage and resilience. They continue to motivate and inspire our work. I feel the true benevolence is not about giving one when you have 10. It is the mere thought of giving one when you have none. So to be charitable and benevolent, it is not resource dependent. And I must tell this story and I end up. This is about the starfish story. 99-2000, when I went to US to train in New Jersey Medical University, that point of time I always used to be worried. Am I doing the right thing? Have I made a right beginning? Until I read a story about Starfish Society which says, the story is like this. There was a beachside, a woman was found throwing something into the sea. Someone who passed by asked, what is it that you are doing? This is a starfish and a snail. Because of the high tides, it's been washed to the shore. I'm putting back into the ocean. Then this person asked, this beachside is miles and miles long. Will that make a difference? She picked up one more snail and put it back into the sea and said, for this, it will make an ocean of a difference. It may not make any difference to the ocean, one more starfish saved, but for a starfish which is saved, it's going to make an ocean of a difference. And I must say, the ocean is calling to all of us. Let's not feel small, let's also make a beginning. And I must say, Rotary has created such beautiful messages, themes. I think we need to also make an appeal to Rotary International. Suppose you can make a theme to end stigma and discrimination world over. There are so many marginalized sections of society, not just HIV/AIDS, women, then transgenders, I think people who are affected with various other illnesses, prison inmates. I think there's so much work that we can do to reach out to eliminate stigma and discrimination in the society. And I must tell you, I'm immensely moved and extremely thankful for having given me this privileged opportunity that I see there's a flame in every one of you to reach out and make a difference, which Rotary as a principle have been doing. I'm very sure each one of you can meaningfully contribute and build many Asha Kiranas like this so that there'll be so much satisfaction for all of you in the years to come. Thank you very much.
Thank you, Dr. Mothi, for the insightful address. You displayed more than 113 slides, but they were not just stories. They are powerful examples of what humanity truly is. Through Asha Kirana, you have touched thousands of lives. May you continue your great service to humanity. And sir, we will remember the starfish analogy. And every time we do a service, we will see that we are helping somebody. Thank you for your address, sir.
ಸ್ವಸ್ಥ ಆರೋಗ್ಯಕ್ಕಿಂತ ಇನ್ನೊಂದು ದೊಡ್ಡ ಆಸ್ತಿ ಇಲ್ಲ ಅಂತ ಹೇಳಿ ನಮ್ಮ ಡಾಕ್ಟರ್ ಮೋತಿ ಅವರ ಮಾತುಗಳನ್ನು ಕೇಳಿ ನಮಗೆ ಮನವರಿಕೆ ಆಗಿದೆ ಸರ್. ಏಡ್ಸ್ ವ್ಯಾಧಿಯ ಕುರಿತು ನಮ್ಮ ಕಲ್ಪನೆಗೂ ಬಾರದ ಅನೇಕ ಕೌತುಕಕಾರಿ ವಿಷಯಗಳನ್ನು ನಮ್ಮ ಮುಂದೆ ಪ್ರಸ್ತುತಪಡಿಸಿದ, ಜಾಗೃತಿ ಮೂಡಿಸಿದ ನಮ್ಮೆಲ್ಲರ ಪ್ರೀತಿಯ ಡಾಕ್ಟರ್ ಎಸ್ ಎನ್ ಮೋತಿ ಅವರಿಗೆ ಹಿರಿಯ ರೊಟೇರಿಯನ್ ಮಹೇಶ್ ಅರಸ್ರವರು ಸ್ನೇಹ ಸೌರಭದ ಸ್ಮರಣಿಕೆಯನ್ನು ನೀಡಿ ಗೌರವಿಸಬೇಕಾಗಿ ಕೇಳ್ಕೊಳ್ತೇನೆ. ಇವರೊಂದಿಗೆ ಡಾಕ್ಟರ್ ಎಸ್ ಎನ್ ಮೋತಿ ಅವರ ಎಲ್ಲ ಮಹತ್ ಕಾರ್ಯಗಳಿಗೆ ಸಾಥ್ ಕೊಡುತ್ತಾ ಬಂದಿರುವಂತಹ ಪ್ರಸಿದ್ಧ ಡಾಕ್ಟರ್ ಸ್ವಾಮಿ ಅವರು ಸಹ ವೇದಿಕೆಗೆ ಬರಬೇಕಾಗಿ ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ.
Dr. Swami, we request you to be on stage as well. Dr. Swami, please join.
Dr. Swami.
We thank you also for joining the morning session. Thank you, Dr. Swami.